The United States is currently facing a significant public health challenge. Reports have now confirmed that this is the most severe flu season the country has experienced in 25 years. So today, we're going to break down the official data, look at the disparities and how it's affecting different people, and go over the key recommendations from health authorities. Here's how we'll walk through it. First, we'll establish just how big this outbreak is on a national scale. Then, we'll dig into the health disparities to see why some communities are hit harder than others. After that, we'll look at a deeper analysis of the systemic issues that experts have identified. And finally, we'll cover the very latest data and what officials say you should do. All right, let's start with the big picture, looking at the sheer scale of what's happening across the country, according to official reports. So, health officials have confirmed something pretty startling. The U.S. has not seen this level of flu activity in a quarter century. Just to be clear, this isn't just a bad flu season, it's a historic one. And that context is absolutely crucial for understanding everything else we're about to discuss. But, those national numbers, they really don't tell the whole story. When you take a closer look at the data, a critical issue comes into focus. There are major disparities in how this outbreak is affecting different communities. This chart from public health experts shows us a key piece of the puzzle. You can see that vaccination rates are not the same across the board. About half of white Americans are reportedly vaccinated, but that number drops to around 42% for Black Americans, and it's even lower for Hispanic and Latino populations. This gap in protection is a really big deal. So the big question is, why do these gaps exist? Well, according to public health physician Dr. Christy Purnell, it comes down to a number of systemic and socioeconomic barriers. Things like a broken trust in the healthcare system that goes back generations, or not having health insurance, or practical challenges like just not being able to get time off work to see a doctor. All of this can lead to delays in getting tested and treated, and it means fewer people have access to those quick, on-demand services that can make a huge difference. And this leads us to a much deeper, more structural analysis. Dr. Purnell argues that to really get what's going on with these barriers, you have to look past individual choices and start examining the system itself. This right here is the central argument from the source material. With this one powerful statement, Dr. Purnell completely reframes the issue. She suggests that the health disparities we're seeing aren't about biology. They are a direct result of systemic forces. So what does systemic racism actually mean in practice? Well, Dr. Purnell describes it as a force that shapes how resources are handed out in society. It impacts who gets access to good jobs with health insurance, and in her analysis, this constant discrimination also creates what's called toxic stress on communities. It's, in her words, literally cooked into the system of healthcare and our society. And there's some powerful data to illustrate this. A 2023 NIH study looked at over 11 million seniors, all of whom were on Medicare, so they all had health coverage. But the study found that even with the same insurance access, Black seniors were less likely than white seniors to get the recommended high-dose flu vaccine. This suggests the problem goes way beyond just access to care. It's about how patients are treated inside the system. And to really understand how deep these issues can run, Dr. Purnell points to a specific and frankly shocking example of medical bias, the falsehood, which was actually in some medical textbooks until recently, that Black people have thicker skin and feel less pain. It's a really concrete example of how discriminatory ideas can get embedded in the very foundation of medical practice. Okay, so with that critical context in mind, let's turn to the situation on the ground right now. Here are the latest official numbers and recommendations coming directly from the CDC. Let's start with the top-line number. The CDC estimates there have been a staggering 15 million flu illnesses across the country so far this season. Just think about that. That's millions and millions of people who've been directly affected. And out of those 15 million cases, an estimated 180,000 have been severe enough that people had to be hospitalized. This number really highlights the incredible strain this outbreak is putting on our healthcare system. And tragically, there has been a significant human cost. Authorities are reporting that an estimated 7,400 people have died from the flu this season alone. That tragic toll includes some of the most vulnerable among us. The CDC has confirmed that so far, 17 children have died from the flu. It's a devastating reminder that this poses a risk to every age group. Now, you might have heard reports about a new flu variant that's been identified, called subclade K. Basically, a subclade is just a slightly mutated version of the main virus. And while this new strain did pop up after this year's vaccine was made, health experts are stressing that the current vaccine is still reported to provide protection, especially against severe disease. So based on all this data, here are the 3 key things health officials are recommending. Number 1, get vaccinated if you haven't already. Number 2, get tested the moment you start feeling symptoms. And number 3, if you test positive, know that antivirals are available and can make the illness less severe, especially if you take them early. So as we continue to track this outbreak and the emergence of new strains, everything we've looked at today leaves us with a really critical question. This isn't just about biology, it's about structure. As viruses continue to change and evolve, how must our healthcare systems evolve to make sure they're providing equal protection for every single person? That's the challenge this flu season has made impossible to ignore.